Hi everyone, and welcome to Medicine Explained. I'm a medical student, and on this channel, we explore fascinating medical topics and break them down in a simple and easy-to-understand way. Today, we're going to talk about psoriasis, a common skin condition that affects millions of people worldwide. By the end of this video, you'll understand what psoriasis is, why it happens, how it affects the body, and what treatment options are available. As always, the sources of information are in the video description, and we can dive straight into today's topic. What is psoriasis? Psoriasis is a chronic autoimmune skin disorder. In simple terms, it occurs when your immune system becomes overactive and triggers your skin cells to grow much faster than normal. Normally, skin cells take about 28 to 30 days to renew, but in psoriasis, this process can happen in just 3 to 7 days. This rapid growth leads to thick, scaly patches on the skin, often red or silver in color. Psoriasis can affect any part of the body, but it most commonly appears on the elbows, knees, scalp, and lower back. There are several types of psoriasis, including plaque psoriasis, guttate psoriasis, inverse psoriasis, pustular psoriasis, and erythrodermic psoriasis. Is psoriasis contagious? As a medical student, I know that a common question people have is whether psoriasis is contagious. The answer is no. Psoriasis is not an infection, and you cannot catch it from someone else. It's caused by an immune system overreaction, not germs or viruses. So you don't need to worry about touching someone's skin or sharing personal items. Psoriasis cannot be transmitted. Causes and triggers. Psoriasis is caused by a combination of genetic and immune system factors. People with a family history of psoriasis are at a higher risk, which suggests a strong genetic link. In individuals with psoriasis, the immune system produces too many T cells, which mistakenly attack healthy skin cells. This overreaction leads to inflammation and a rapid turnover of skin cells, causing the characteristic patches and scales. Certain factors can trigger or worsen psoriasis symptoms. For example, stress can play a significant role, as mental and emotional stress often makes flare-ups more severe. Infections, such as streptococcal throat infections, can trigger specific types of psoriasis, like guttate psoriasis. Medications may also contribute, with drugs like beta blockers or lithium sometimes exacerbating symptoms. Finally, environmental factors like cold, dry weather can make the skin more prone to irritation and worsen the condition. What are the symptoms? The main symptom is red, raised patches covered with silvery scales. Other common signs include itching or burning sensations, cracked or bleeding skin, and nail changes, such as pitting or thickened nails, which happens in up to 50% of cases. Psoriasis is not contagious. You cannot catch it from someone else, and it's not caused by poor hygiene. How psoriasis affects the body. Although psoriasis primarily affects the skin, it is actually a systemic condition. This means that the effects of psoriasis are not limited to the skin alone. For example, it can lead to psoriatic arthritis, which causes joint pain and stiffness, making movement uncomfortable or difficult for some patients. Psoriasis can also increase the risk of cardiovascular diseases, including heart attacks and strokes, due to the chronic inflammation it causes in the body. In addition, people with psoriasis may be more prone to metabolic syndrome, obesity, and type 2 diabetes. Understanding psoriasis as a whole-body condition is crucial because it helps guide both medical treatment and lifestyle management, allowing patients to better manage their overall health, not just their skin symptoms. How can psoriasis be treated? The treatment of psoriasis depends on the severity and type of the condition. For mild cases, topical treatments are often the first step. Creams containing corticosteroids, vitamin D analogs, or specialized moisturizers can help reduce inflammation, slow down skin cell turnover, and soothe the affected areas. For patients with more persistent or widespread psoriasis, phototherapy can be an effective option. Controlled exposure to UVB light helps slow down the growth of skin cells and can improve symptoms over time. In addition to UVB phototherapy, PUVA therapy may be used in more severe or treatment-resistant cases of psoriasis. This approach combines exposure to UVA radiation with a photosensitizing agent psoralen, taken orally or applied topically, which enhances the skin's sensitivity to light. PUVA works by suppressing excessive keratinocyte proliferation and modulating immune activity in the skin, leading to significant improvement of psoriatic lesions. However, due to potential side effects, including nausea, phototoxic reactions, and an increased long-term risk of skin cancer, PUVA is generally reserved for selected patients. In moderate to severe cases, doctors may recommend systemic medications, which work throughout the body to target the overactive immune system. These may include oral medications or biologic drugs, which specifically block the immune signals causing psoriasis, such as methotrexate, cyclosporine, or acitretin, and biologic agents like TNF-alpha inhibitors, as well as IL-17 and IL-23 inhibitors, which target specific immune pathways involved in psoriasis. Alongside medical treatments, lifestyle management is extremely important. Reducing stress, maintaining a healthy diet, quitting smoking, and avoiding personal triggers can significantly help control flare-ups and improve overall quality of life. Even though psoriasis is a chronic condition, with the right combination of treatments and lifestyle adjustments, many patients can manage their symptoms effectively and lead a normal, healthy life. Thank you so much for watching. I hope you now have a clear understanding of psoriasis and how it affects the skin and body. Remember, this video is for educational and informational purposes only. It is not intended as medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional for any medical concerns or questions. Don't forget to subscribe to Medicine Explained for weekly videos. We release new content every Friday to make medicine simple and easy to understand. If you found this video helpful, give it a like, and feel free to leave a comment with questions or suggestions for future topics. See you next Friday.